Everybody, it's Dr. Bulkavage. We're back for part 2 of the GI series, and today we're going to talk about the stomach. On the first episode of the GI series, we talked about the starting process of digestion in the mouth, and that started with chewing. It started with the release of saliva in the mouth, and we talked about how the saliva starts really the process of the chewing, and the saliva helps start the process of breaking down our foods. And we get this stimulation of a cranial nerve called the vagus nerve. And that vagus nerve is located in the brainstem. And when we get all the stimulation, we get this vagal nerve stimulation, then the vagus nerve starts working on the GI tract to promote appropriate digestion. Now, stress, our fight or flight system, inhibits vagal nerve stimulation because the vagal nerve is part of the parasympathetic system, or the rest and digest and heal system. So we can't be stressed out and have good vagal stimulation. We need to be rested. We need to be relaxed. That's what we talked about before you eat, to sit down, pray, meditate, just chill out a few minutes before you start putting food down your gullet. Slow down when you eat, chew your food more. Okay, but once the food's in the stomach or in the system and it starts heading into the stomach, then the vagus nerve starts stimulating a number of different cells in the body. And those cells are the G cells, the ECL cells, the goblet cells, delta cells, parietal cells, and chief cells. So I'm going to give you a brief explanation of what all these cells do and the products they make, and then we'll talk about what inhibits this process a little bit more. So the primary neurotransmitter for the vagus nerve is something called acetylcholine. And so when you get vagal nerve stimulation and it communicates with the cells via acetylcholine, you get the G cells stimulated. Now the G cells produce something called gastrin. The ECL cells are also stimulated by the vagus nerve, and it makes histamine. So the histamine that's made by the ECL cells and the gastrin that's made by the GCL cells, along with some acetylcholine, stimulate another set of cells in the stomach called the parietal cells. And the parietal cells produce something called HCl, hydrochloric acid. And it's the hydrochloric acid that really starts engaging and breaking down the proteins even more than was done by the saliva and mastication. And so this HCl drops the acid in the stomach, and the acidity of the stomach is really low, like 1 to 2 of a pH. That's enough to eat through your floor. But the nice thing is that your vagal nerve stimulates cells called your goblet cells, which produce mucin when you put food into the stomach. And that mucin actually creates mucus that protects the stomach from being damaged. The esophagus doesn't have those mucin cells to release the mucus, so it's not as protected. So when there's reflux or a reflux of stomach acid up into the esophagus, it doesn't have that protection. But the stomach does. It's designed to be very, very acidic. And we want that stomach contents to be very acidic because it helps break down proteins, helps with the absorption of iron and calcium and B12. It helps kill off some of the organisms. And these enzymes work best in an acidic environment. So if you don't have an acidic pH somewhere down around 2 or below, these enzymes don't work. And so you don't get breakdown of fats and proteins and absorption of B12 and iron and calcium. So the parietal cells make HCl. The parietal cells also make something called intrinsic factor. Now intrinsic factor takes the B12 that was bound to your haptocrine that we talked about in the saliva, that transcobalamin 1, and it takes it from the transcobalamin 1. The B12 is bound to the intrinsic factor, and that intrinsic factor helps with the absorption of B12. The gastrin produced by the G cells also produces or stimulates something called chief cells in the stomach. And the chief cells produce gastric lipase, which works to help further break down fats. Now we said there was a lingual lipase. Now we're talking about gastric lipase. Both of those help break down fats. And the reason these are so important is because if we break down these fats with lipase, then we don't need the use of bile acids that we're going to talk about later. These fats are ready to be absorbed without the need for bile acids, which is great. The chief cells also produce something called pepsinogen. And pepsinogen isn't really active until it gets converted into pepsin. And again, it needs an acidic environment for this reaction to occur. And the pepsin further breaks down proteins. Now, why is the breakdown of proteins so important? Because the proteins break down into amino acids, which we use for everything in the body, to make hormones, to make cells, to do detoxification, to make neurotransmitters, to make muscle tissue, to make everything in the body. You need these amino acids. They're the building blocks of our physiology. And so we talked about goblet cells producing mucin that protects the stomach. And we've got one other cell we need to talk about. The vagal nerve stimulates the production of stomach acid, but it also stimulates something called the delta cells. So vagal stimulation of the G cells produces gastrin. Gastrin stimulates the chief cells to do things. Gastrin stimulates the parietal cells to do two things. And the gastrin also stimulates the delta cells along with an enzyme called VIP to produce something called somatostatin. And somatostatin is found in lots of different tissues in the body. But somatostatin in the stomach is inhibitory, and it really starts shutting down the production of stomach acid. So the vagal nerve stimulates the production of stomach acid, and then it actually self-regulates by shutting the process down. So that's how this whole process works. The key, though, is stress decreases vagal stimulation. So if you're in fight or flight, you're under stress, you're rushing between activities, you just got to fight with your spouse, or you've had a rough day at work, and you sit down to eat because you're stressed out, you just feel like you got to eat something, you're not going to digest your food well. It's going to create problems. It's not going to be digested well, it's not going to be absorbed well, you're going to be more prone to gas, bloating, pressure, infection, and what we call dysbiosis. So one of the keys is to reduce our stress, because if you have high stress, there's decreased vagal stimulation, you have decreased acetylcholine, and then there's less acetylcholine to inhibit the delta cells. So the delta cells can then produce somatostatin, which can artificially suppress HCl. So it can cause you to have this, what we call hypochlorhydria, or a lack of stomach acid production. So we want to rest. We want to get ourselves in a mood, in a mindset, in a frame where we're calm and relaxed when we want to sit down and eat, to have the best digestive processes. So acidic pH is critical to this process happening, which means if you take any type of antacid for reflux, just so you know, is not caused by too much stomach acid. It's actually caused by too little stomach acid. But what happens is the esophageal sphincter doesn't close well enough when this acid does not get low enough, the esophageal sphincter doesn't really close tight enough, and you get a reflux of acids up into the esophagus. The esophagus doesn't have the mucin to protect it, and so it damages it. And so you can get something called Barrett's esophagitis, where it's all inflamed and damaged and irritated. But if you take antacids, this whole process becomes compromised. So you can't break down proteins. You become iron anemic, and you lose calcium, and you become B12 deficient, and you have fats that aren't being broken down, and pepsin doesn't work. So we really, when somebody's got reflux, we actually want to stimulate, improve their acid production, not limit it. And one of the things, the best ways to do that is reduce stress and the inhibition of the vagal nerve. So things you can do at home are called vagal stimulation exercises. You can do some deep breathing exercises, something called buteyko breathing exercises. When we do better breathing, especially when we do nasal breathing, we can cause relaxation in the body. Meditation helps calm us, helps relax us, helps with our breathing. That can be very good. That's why prayer, maybe meditation before eating, is really good. Cold therapy, like you splash really cold water on your face, can stimulate vagal activity. Humming, and you hear people, sometimes people do the hum, but just humming, and humming really loud, can stimulate the vagal nerve. You can gargle, you can gag yourself, and you can sing really loudly. All those things will stimulate the vagal nerve. So a couple things to do to improve vagal stimulation and improve digestion in the stomach include, when you wake up in the morning and you're brushing your teeth, take your toothbrush and gag yourself a couple times. What you're looking to do is get your eyes to tear. Then you know you've stimulated that area of the brain where that vagus nerve lives. So brush your teeth, brush your tongue, gag yourself a couple times just to get your eyes to water. When you're done, gargle really hard with a glass of water. That will stimulate it. And then on your way downstairs to go eat, do some humming or singing on your way down. Before you're going to eat, make sure you're not running around to eat, and you will start to you'll have better vagal stimulation. And then when you eat, slow down. Take more time to chew. We said chew maybe 20 bites, each bite about 20 times. Don't drink a lot of fluids when you are eating. If you're thirsty when you're eating, you're not chewing enough. And you don't want to drink tons of fluid because you don't break your foods down as much. You dilute your salivary, your saliva, and all those enzymes that are in there. At night before you go to bed, same thing. Brush your teeth, brush your tongue, gag yourself, gargle. All those things will stimulate the vagal nerve, and when you stimulate the vagal nerve, you also stimulate your rest and digest process, which can help you with the sleep process. So hopefully that helps. This is the GI series part 2, where we talk about the stomach and stomach function. If you have any questions, just put any comments or questions in the area below wherever you see this video, whether it's on AskDrBobCavage.com, on YouTube, or on my website, chronicconditionrecoverycenter.com. Take care.